If you have a painful white spot between your toes on your foot, it could be what's called a soft corn. Stay with me. I'm going to share with you how it happens and what you can do about it to decrease pain next. Hey everybody, it's Dr. Gaffney saving you time and money in your foot health decisions. And please like and subscribe if I'm helping you at all. I appreciate it. Anyway, so a corn is a layer of dead skin due to friction or pressure on the top of the toe. It's called a hard corn. When it's between the toes, it's a soft corn, and it starts looking like a white spot because of all the moisture between the toes, and the callus there, or the corn, hyperkeratotic tissue we call it, becomes white and it looks like a white spot. And because it's softer doesn't mean it doesn't hurt like the hard corn does, because it certainly does. My patients tell me it's like a rock stuck between their toes, so it hurts a lot. Now, soft corns commonly are associated with foot deformities. The most common area where you can find it is associated with a bunion. So a bunion is just an abnormality of bone at the side of the big toe, and the big toe moves over towards the second toe and presses on it, and you tend to get a corn at the side of the big toe and the side of the second toe where they rub together, and it's very painful. The other place people tend to get it commonly is between the fourth and fifth toes. So the fifth toe, a lot of times it'll curl to the side based on how your tendons are pulling, and so the fourth and fifth toes are usually curled into one another, so you can get that prominent toe joint pressing on the fourth toe joint, and that's where you can get it as well. And sometimes this is the worst place to get it. It's at the base of the fourth web space, and that's the hardest place to deal with the soft corn. So it has a lot to do with toe crowding. So there's many things you can do to help with that, but the primary cause of getting a soft corn is the underlying bony deformity. Sometimes it also can be just a real hypertrophied toe joint from arthritis. The probably best thing to do is try to get a really wide toe box, like an anatomical toe box like that an Ultra sneaker might have, or a Bronax sneaker, sandals, just to give your toes lots of room so they don't rub together. So it is caused by the underlying bony deformity, as I had said. It's hard for patients, I think, to understand that unless you have the underlying bony deformity corrected, you're not going to get rid of your soft corn. In case in point, I had this little old lady. She was a cute little patient that would come in once a month, and she'd be like, "Doc, just take out the soft corn, just take it out for good." And I kept telling her, "I'm sorry, ma'am, you've got a large bunion deformity, you've got hammer toes, and those are rubbing together and making your corn." And I'd shave it down for her every month and get rid of it that way. And sure enough, the bony deformities would rub together, and she'd be back again the next month with her corn. Finally, she did understand what I was telling her, that it was the bony deformities, and unfortunately, surgery was the only way to get rid of it, and she, due to her other medical problems and lack of support system, could not undergo it. But we did change her shoes up and got her into some pads that helped to offload it, and she was a lot more comfortable. And I'm going to share some of those pads with you today on this episode. So one of the things I did for the patient I was telling you about is using these little felt adhesive pads. They're little corn pads, and they work so much better than the over-the-counter foam pads because the felt is better offloading. It's denser than the foam. The foam compresses and doesn't offload as much. So that's why I like using these felt adhesive pads. And I do have them in my online store if you want to check it out. And how I have my patients use this is, like, I'll put this on the side of the big toe joint, like the prominent side like that. And then I'll put the other part on the inside of the other toe like that, so they won't compress together and don't rub, and it works really well. Sometimes I'll even put paper tape on it to hold it together, but most of the time with the toes being compressed together, that's enough to hold it there. If you have multiple toes that are crowded and bothering you, this long little gel tube that you could cut up to fit, it has gel on the inside, just cushions it and protects the toes from rubbing together. So on the baby toe curls in and it presses on the fourth toe. Sometimes the metatarsal bone of the fourth metatarsal is real prominent, and the fifth toe can rub against that, and you get the corn, soft corn at the web space at the very bottom there. So sometimes I'll use this on that situation. I'll cut it to fit, and I'll show you how I do that. Here's the Silipose pad for the baby toe. I love these things. They have, look at that, this thick silicone. That'll really cushion it and help people in their shoes from that knuckle rubbing. And if you can get this helps a lot, preventing like inflammation of that fifth toe joint in the shoe. You can turn it on the inside too if it's rubbing against the fourth toe to help prevent against a soft corn. On my website, I have these baby toe cushions. So baby toe gets so much pressure on the shoe. So these little baby toe pads, this like silicone is just super nice for protecting the toe against the shoe pressure. And also it'll separate it from the fourth toe so there's no rubbing and you won't get that soft corn. Lastly, if you do have a baby toe that's curled in and rubbing against your fourth toe, making a soft corn, or the knuckles rubbing in the shoe, driving you crazy, there is a nice in-office procedure that can correct it. And it's a percutaneous type surgery, so there's no big incision. You don't have an incision to heal. And it's done in office under local anesthesia. And basically you're back on your feet within a day. If you want to learn more about that procedure, check out my YouTube episode on that. Last but not least, you can use these little gel spacers between the toes, especially between the big toe and the second toe, especially if your soft corn is out towards the end. You put this way down at the base, it'll keep those two apart and less likely to develop the corn. If your feet happen to be real sweaty, then I love this little triple foam spacer by Pedifix. You can put that between your first and second toes. Next, I recommend to my patients to get 40% urea cream, and I'll have a link in the description where you can find it. And you can get 20%, it's a little bit safer than 40%. 40% might be a little bit too aggressive for some people, especially those with diabetes or poor circulation. So check with your doctor first before you try anything. So the urea cream will soften it and keep that callus from forming or the corn from forming as quickly. So I have my patients put that on at night with a Band-Aid to really soak in there. One treatment that I don't recommend for most of my patients to use is the over-the-counter corn or callus medicine because it has salicylic acid in it. And salicylic acid will wear down the top layer of your skin and can cause a wound and in some cases an infection. It's especially dangerous in diabetics and those with poor circulation, so I never recommend that to those type of patients, and I don't like my regular patients to use it either. I've just seen too many problems from it, so that's why I have people use the urea cream. I really hope this helps you with your soft corn, and see your podiatrist before you start any type of treatment. They'll really guide you in the right direction. Also, I have another YouTube episode on how to get rid of your corn if you want to learn more. We'll see you next time. Thank you so much for watching.
Please see the full disclaimer in the description. This is not a doctor-patient relationship. This does not constitute medical advice, but is for informational purposes only.